Hello, everyone. I am Dr.C.P. Tanwar. I'm currently practicing at Fortis Escorts Hospital, Jaipur, India. My areas of interest, they include hepatology, juvenile gastroenterology. So I take an opportunity to talk on one of the world's most persistent global public health issues. And this one is viral hepatitis B. So hepatitis B is a vaccine preventable disease that occurs due to infection with hepatitis B virus. It spreads when the hepatitis B virus present in the blood, semen, or other infected body fluids from a person enter the body of someone who is not infected. If we talk about India, the prevalence of hepatitis B surface antigen is around 3 to 4.2%. So basically, if you calculate, so it comes at around 40 million hepatitis B virus carrier population is living in India. So this is a huge number. And if we talk about the mortality associated with the disease, so each year, approximately if you talk, 1,15,000 Indian population, they dies of hepatitis B and the related health issues. There are about 10 known genotypes of hepatitis B, and they're classified like A, B, C, D, E, F till J. And among the most common genotype in India, it is the hepatitis D genotype, which is most common, and which is followed by A and C genotype. Now, why it is important to know about genotypes? Because the identification of genotype helps us in the prognosis and the treatment of patients. Now, when we talk about the transmission capacity, you would be surprised to know that hepatitis B virus is 50 to 100 times more infectious than HIV. So the main ways of getting infected with this virus, they are from mother to baby at birth, which we call as perinatal, child to child, especially if we talk about in a household setting, unsafe injections and transfusions, and unprotected sexual contact. So these are the major routes of transmission of this virus. If we say, what are the examples if we talk in day-to-day life? So I want you to be aware of this thing, like if you're sharing items like razors or toothbrushes with an infected person, or if there is a direct contact with the blood or open source of an infected person, could be unsafe tattoos or piercings, and exposure to blood from needle sticks or other sharp objects, they all can lead to the transmission of hepatitis B virus. Now, once you're infected with this virus, not all people who are newly infected with this virus, they have symptoms. But for those that do, the symptoms, they can include fatigue, lack of appetite or poor appetite. There might be some stomach pain, especially on the right upper side. It's a mild discomfort. The patient may have nausea, vomiting. They may have yellow discoloration of eyes and urine. So if one notices any of such symptoms, then I definitely want to appeal him or her or to the caregiver to immediately rush to a doctor. For many people, hepatitis B is a short-term illness. For others, it can become a long-term, chronic infection that can lead to serious, even life-threatening health issues like cirrhosis and hepatocellular cancer also. If we talk about the risk, that who is at the most risk to develop chronic infection, so here children who are less than 6 years of age who become infected with the hepatitis B virus, these are most likely to develop chronic infection. Over 80 to 90% of infants and 30 to 50% of children who are infected at less than 6 years of their age, they develop chronic infection. So means once they are infected, there is a very high percentage that they develop chronic infection. And otherwise, if we talk, then less than 5% of otherwise healthy adults who are infected, they will develop chronic infection. So those are the risk factors. Now, if we come about that, how do we diagnose that someone is infected with hepatitis B? So there are certain laboratory diagnoses. So for the laboratory diagnosis of hepatitis B infection, It focuses on the detection of an antigen which is called as HBS antigen. It is also known as the Australia antigen or hepatitis B surface antigen. So acute hepatitis B virus infection is characterized by the presence of this antigen, HBS antigen, along with an immunoglobulin in your blood, that is immunoglobulin M. So this antibody is present to the core antigen, which is called as HBC antigen. So this is about acute hepatitis B virus. But once you are infected with acute hepatitis B virus, there is currently no specific treatment for this acute hepatitis B. What we do is the care of those patients who are infected with acute hepatitis B. It is aimed at maintaining their comfort and maintaining an adequate nutritional balance, which includes replacement of fluids that are lost from vomiting and diarrhea. And the majority of the patient, they recover. While those persons who are infected with chronic hepatitis B, there we have option to treat them with drugs, which includes oral antiviral agents. So this treatment, it slowed down the progression of liver cirrhosis, it reduced the incidence of hepatocellular carcinoma, and overall it improves the long-term survival of the patient. So WHO recommends the use of oral treatments like tenofovir and entecavir because these are the most potent drugs to suppress this virus. And more importantly, these are simple to take, like 1 pill a day, and they have a very few side effects. And for most of the people, however, there is no total cure of hepatitis B infection. This is very important. Therefore, most of the people who start hepatitis B treatment, they usually have to continue it for lifetime. As we say that an ounce of prevention is much better than a pound of cure. Hepatitis B vaccine, they are the mainstay of hepatitis B prevention. So safe and effective vaccines, they are widely available for the prevention of hepatitis B virus. The World Health Organization recommends that all infants should receive hepatitis B vaccine as soon as possible after birth, and if possible, within the 24 hours of the birth. So on this World Hepatitis Day, the healthcare community together pledges to fight and prevent hepatitis B and save lives by ensuring access to the testing and treatment for hepatitis for everyone, everywhere. Thank you.